The eyes have long been known as the windows to the soul, reflecting emotions, vitality, and the beauty of each person. However, few people know that the eyes are not only tools for observing the outside world, but also mirrors reflecting the internal health status of the body. Even small changes in the eyes can sometimes be silent warnings of dangerous diseases we might not expect. Some people discover diabetes not through blood sugar tests, but from changes in the retina. Others find out they have high blood pressure only when an ophthalmologist detects abnormal blood vessels in the eyes. There are also cases where pale or yellowish eyes signal anemia or liver disease. In modern life, when we often only care about the eyes in terms of aesthetics or vision, understanding that the eyes can also reveal hidden diseases becomes even more important. By listening to and paying attention to changes in the eyes, we can detect many dangerous diseases early, allowing timely intervention and avoiding unfortunate complications. Below are 5 silent diseases that can be revealed through the eyes. Warnings you should never ignore. 1. Diabetes and diabetic retinopathy. Diabetes is considered a silent killer because it often progresses quietly and only shows complications when severe. One of the most dangerous complications of diabetes is diabetic retinopathy. Mechanism: when blood sugar levels remain high for a long time, they damage the small capillaries in the retina, the light-sensitive tissue at the back of the eye. Gradually, these blood vessels may leak fluid, bleed, or form abnormal new vessels. This condition not only reduces vision, but can also lead to permanent blindness if not treated promptly. Signs: blurred vision, unclear sight, especially when reading or driving. Fluctuating vision, sometimes clear, sometimes blurry. Appearance of black spots, floaters, or blank areas in the field of vision. Difficulty distinguishing colors, especially similar shades. Examination: diabetic patients are advised to have annual eye exams. Ophthalmologists use ophthalmoscope to directly examine the inside of the eye. Optical coherence tomography, OCT, provides detailed images of the retina's structure. Retinal photography to detect early microvascular damage. Thanks to these, diabetic retinopathy can be detected early, even before obvious symptoms appear, too. High blood pressure and hypertensive retinopathy. High blood pressure is often called a silent killer because most patients do not know they have it until complications occur. One of the earliest and most noticeable affected organs is the eyes. Impact on the eyes. Prolonged high blood pressure damages the walls of retinal blood vessels, leading to hypertensive retinopathy. Blood vessels may narrow, thicken, or even leak blood or fluid. This also signals that the heart, brain, and kidneys are under threat. Signs: blurred vision, reduced eyesight. Headaches, pain around the eye sockets. Red eyes or a feeling of swelling and pressure. Examination. During the exam, the doctor observes the retina for narrowed blood vessels, a characteristic sign of high blood pressure. Retinal hemorrhages or optic disc swelling, warning that high blood pressure has caused severe damage. Notably, these signs may appear before the patient knows they have high blood pressure, so a regular eye exam can literally save lives. 3. Glaucoma. If the retina is the screen, the optic nerve is the cable transmitting images to the brain. When this nerve is damaged, vision gradually deteriorates. The main culprit is glaucoma. Nature of the disease. Glaucoma usually occurs when eye pressure increases, compressing the optic nerve. However, some types progress even with normal eye pressure. The most dangerous aspect is that the disease has no obvious symptoms in the early stages. Most patients only discover it after significant vision loss and irreversible nerve damage. Signs: loss of peripheral vision, causing a tunnel vision effect, seeing halos around lights, especially at night. Some cases may experience eye pain, redness, nausea. Examination. Doctors perform tonometry, measuring eye pressure, Optic nerve observation, using specialized cameras or microscopes. Visual field test, to detect early peripheral vision loss. Early detection and treatment can control the disease with eye drops, laser, or surgery, preventing blindness. 4. Age-related macular degeneration, AMD. When discussing eye diseases in older adults, age-related macular degeneration cannot be overlooked. It is the leading cause of blindness in people over 50. Mechanism. The macula is the central part of the retina responsible for sharp vision, helping us read, drive, and recognize faces. When the macula degenerates, central vision is lost while peripheral vision remains. Signs. Straight lines appear curved or distorted. Black spots appear in the center of vision. Difficulty seeing details, especially when reading or doing close work. Examination. Fundus exam. Doctors directly observe macular damage. Mott, Amsler grid. Distorted or missing lines indicate AMD. OCT imaging. Detailed cross-sectional images of the macula to monitor disease progression. Early detection, lifestyle changes, eating green vegetables, supplementing lutein and omega-3, and treatment with medication or laser can slow degeneration. 5. Anemia and other hematologic disorders. The eyes not only reflect the condition of blood vessels and nerves, but also reveal the quality of blood in the body. One of the clearest signs is anemia. How eyes reflect anemia. Pale conjunctiva. When red blood cells are low, the eyes lose their rosy color. Yellowish eyes, often seen in hemolytic anemia or liver disease. Abnormal retinal blood vessels, may be due to anemia or other blood disorders. Signs. Pale, lifeless eyes, may be accompanied by red eyes or conjunctivitis. In some cases, small retinal hemorrhages are detected by doctors. Examination eye exams can help doctors suspect anemia. Blood tests are then performed to determine anemia severity and cause, iron deficiency, vitamin B12 deficiency, bone marrow disorders, etc. Oshin. Early detection of anemia not only improves eye health, but also prevents serious complications such as heart failure and weakened immunity. The eyes not only help us see the world, but also serve as a health mirror, reflecting the condition of the entire body. Small changes in the eyes can be warnings of serious diseases like diabetes, high blood pressure, glaucoma, macular degeneration, or anemia. Therefore, do not only care for your eyes in terms of aesthetics or vision. Have regular eye exams at least once a year, especially if you belong to high-risk groups such as middle-aged or elderly people, or those with diabetes or high blood pressure. Early disease detection not only protects vision, but also maintains overall health and prevents many dangerous complications. Thank you for watching this video. If you find the content useful, don't forget to visit and support the channel Everyday Life, where we share health knowledge, nutrition, and scientific living tips to help you and your family stay healthy and peaceful every day. Wishing you success and good health. See you in the next videos.